Dr. Bader, thank you for agreeing to join us today. We're honored to have you discussing with us this important topic. Dr. Bader is a sports medicine doctor who can address any issue or injury associated with sport, an orthopedic specialist who works with the athletes and people suffering from musculoskeletal injuries in general. Dr. Bader, from your experience being a successful physician in the field, can you tell us who are the patients you encounter the most in your practice as a sport medicine physician?
Okay. السلام عليكم. أول شيء الله يعطيكم العافية جميعاً. I would like to thank the organizing committee for this invitation. إن شاء الله تكون يعني صراحة ما توقعت العدد هذا. أتمنى أن نفيدكم كثير يعني. I would just raise the issue and a lot of discussion about the sport medicine. قبل كل حاجة أنا انصدمت أول شيء. أنا انصدمت غادة. في ناس ما يعرفوا إنه في حاجة اسمها سبورت ميديسن كسب سبيشاليتي، إنه في أوكي. في أحد ثاني ما يعرف إنه في شيء اسمه سبورت ميديسن. كويس لي، معناها إنه this is a good discussion إنه يكون في شيء زي كذا. أوكي. أول شيء feel free any question to interact. ما نبغاها presentation، نبغاها discussion، نبغى الكل يستفيد من هنا. أول issue اللي I would like to raise it doesn't mean I'm a sport medicine إنه كل البيشن اللي يجوني it's sport related injury. This is a wrong concept. Actually أغلب المرضى اللي يجوني ما له أي دخل في سبورت. This is ولكن الانجري اللي صارت له it's related لأغلبها الناس اللي involved في الأثليتس patient. مثلا أنا شغال في الميليتري هوسبيتال، واحد في الحد الجنوبي طاح من فوق الجبل twisted his ankle, twisted his knee, he have multi-leg injury. This is a sport case, but it's related to different mechanism. في الأعياد طبعا كبار السن أمهاتنا الله يعطيهم العافية تزلق في دورة المياه تمسك كذا she have rotator cuff tear. أغلب الناس اللي عندهم باسكتبول يلعبون باسكتبول ولا فولي بول ولا يجيهم rotator cuff tear. أغلب الروتيتر الكف اللي يجوني فوق ال60. ما أذكر إنه جاني أحد ينق. doesn't mean sport injury. That mean the patient involved in sport activity. This is very important. يمكن هذا يكون جواب على سؤالك جيهان. صوتي واضح يا جماعة؟ أوكي.
You can hear me clearly, right? Okay. Thank you, John, for the lovely introduction about our topic today and for welcoming our guest speaker, Dr. Bader. So, Doctor, we will continue our session with a common misunderstanding. One is sports medicine versus the orthopedic sports injury. What is the root for this subspecialty? What is it about? Can you clarify that concept?
Okay. Orthopedic surgery have different subspecialty. Arthroplasty, اللي تغيير مفاصل, foot and ankle, pediatric orthopedic, oncology, orthopedic oncology, spinal surgery, and sport medicine. إذا في أحد interest في sport يمكن يدخل عن طريق 3 subspecialty: emergency, family medicine, and orthopedic surgery. الآن يمكن يجي السؤال إيش الفرق بينهم؟ طب لو أدخل orthopedic وإيش الفرق بينه؟ يعني mostly الامرجنسي mostly الامرجنسي والفاميلي ميديسن it's the same fellowship. بس الأورثوبيديك surgery it's more involved في الكيسز اللي تحتاج surgical intervention. For example البيشنت فاميلي الدكتور فاميلي ميديسن في العيادة عنده ankle sprain, عنده tendinitis, عنده باتيلو فيمورال syndrome. هذا كلها كان treated non-surgically. اوكي فالفاميلي ميديسن ولا الامرجنسي ميديسن اللي عنده سب سبيشاليتي او فيلوشيب في السبورت ميديسن he can treat these cases. احنا كاورثوبيديك سيرجري نقدر نعالج الحالات هذه بلس if he needs surgical intervention. طبعا ايش الميزه الثانيه في الفاميلي ميديسن ولا الامرجنسي ميديسن اللي عندهم سب سبيشاليتي في السبورت ميديسن؟ غالبا هذول الفيزيشن اللي يكونون انفولف مع اللاعبين في الانديه وكذا، فهو يكون part of the team of nutritional او حق الريهاب، هو part of the team السبورت ميديسن.
All right, thank you, Doctor, for the answer and clarification. Further, we are going to talk about what are the most common related injuries or sports-related injuries in the kingdom. So the first one we have found after doing a little bit of research in our one-pager and after asking Dr.Bader as well, is that there are common injuries that happen, as Dr. mentioned earlier, to athletes and non-athletes. One of the most common ones is number one, ankle sprain. So doctor, can you please clarify what is ankle sprain exactly and how does it occur?
Okay, first of all, who got ankle sprain before? Thank you. A lot of people, huh? I can understand this a lot of number. The most common internationally sport injury or sport-related injury, it's ankle sprain. Internationally, not only in Saudi Arabia, it's internationally. Many people, almost all the sport activity, the most common ankle sprain, even the volleyball, even the basketball, it's ankle sprain, okay? It's a twisting of the ankle with feeling of bulb. There is ecchymosis, discoloration. I'm not going to discuss the management of the ankle sprain, but it's very common. The good things, it's not always necessitate or initiate in surgical intervention. Most likely, it's conservative treatment, the ankle sprain.
All right, thank you so much, Doctor. As you guys can see, we included two videos or GIFs. There's the one in heels, which is pretty common. I think every girl has felt this at least once.
Okay, now just I'm intentionally bring this video just to let you know the sport injury, it's not always related to sport, okay? And most common ankle sprain I face in my clinic due to high heel, okay? For the female. So, the problem is the patient with ankle sprain, after twisting from high heel, the first question, when can I go to high heel? Something irritating in the clinic صراحة.
So don't wear high heels. The next video is this one. It's from a basketball game. I think you can clearly see the player wearing all white. His right leg. I'll play it again. Over here.
Ouch.
That was pretty painful. Anyways, moving on to our next.
So there is no any voice when they saw the heel.
Yeah. I can tell. I see how it is. But that one actually looks really painful. We'll move on to the next injury, which is MCL tear and ACL tear. I think everyone has heard of this, and it's very common.
Okay.
First, this is a clarification photo for you guys to know what's median and what's lateral, and I'll let the doctor.
Yeah, MCL, it's the most common. Okay, it's the second most common after ankle sprain, okay? So it's the most common injury in soccer player, MCL. After that, it's ACL. It's usually due to valgus stress to the knee. There is 3 grade. The good things, because it's the most common, it's not always initiate surgical intervention. It's always treated conservative, okay? So it's very important to diagnose and to give the patient proper time for rehab. Actually, this is need surgery.
Doctor, the surgical intervention will
Surgical intervention.
surgical.
Yeah.
Sure. I think you guys can clearly see, and football is notorious for ACLs and MCLs as a sport. So that's for the MCL care. It occurs during activities that include bending, twisting, and quick change of direction. There's pain and swelling, lack of moving the joint, and it often happens during contact sports. As for ACL, it's the injury to the anterior cruciate ligament. You guys can see.
Who's this? مين شاف الإصابة هذه؟ أحد شاف الإصابة هذه؟
I saw this actually live. I
Okay.
see two hands. No way. I think you guys watch more sports than girls. It's faster.
Okay. Okay. This is hyperextension of the knee. This is the second more mechanism causing an ACL injury. Usually, it's twisting injury, pivoting non-contact injury for the knee. But the hyperextension, usually the patient presents with ACL, sometimes with PCL also.
Okay, we will move on to the next one. Shoulder dislocation. As you guys can see, he popped it back. Doctor, can you further elaborate?
Okay. Shoulder dislocation, it's very common in volleyball player and basketball player. The good things in the females, usually they have hyperlaxity. Hyperlaxity is not indicated for surgical intervention for the shoulder dislocation. But any shoulder dislocation, my personally treated surgically when first time dislocation. Okay, if the patient, he don't have any laxity, because the study show if the patient have shoulder dislocation less than 25 years old, he gonna have recurrence of shoulder dislocation. What's the problem in that? Sometimes, always we treated the shoulder dislocation by arthroscopy. If recurrent shoulder dislocation happen, it may affect the glenoid bone, so we change our management from arthroscopic to open surgical intervention. That's why I prefer immediate surgical intervention for the patient who have recurrent, who have shoulder dislocation, not recurrent. Yes.
Is it that easy to learn how to pop it back in regarding the video?
So easy.
So easy.
Yeah, actually, I think this guy, he have recurrent shoulder dislocation. Otherwise, he will never ever can return it back easily like this. Okay, so usually the patient who have shoulder dislocation, he require emergency department under conscious sedation to reduce this shoulder. Otherwise, he can reduce it by himself if he have recurrent shoulder dislocation. And some people, they said, I have the experience, I know how to reduce myself, but it's painful.
Doctor, can it go wrong?
No, ever.
So is it pop back into normal position?
That's
or-
mean reduction.
Okay.
It will never go anywhere else, only the joint.
Okay, great. Next injury is the rotator cuff tear. Please, doctor.
I never saw young people with rotator cuff tear. Full stop. It's always an elderly patient, above 50, 60. I just speak about shoulder dislocation. Any shoulder dislocation in young people, I always tell them you're gonna have recurrent shoulder dislocation. Any shoulder dislocation above 40, I have to suspect rotator cuff tear. So shoulder dislocation in young, that indicate surgical intervention to prevent recurrent shoulder dislocation. Shoulder dislocation in adults or in above 40, you have to think about rotator cuff tear, okay?
Okay. So, I'm sure everyone now is wondering, like, all of these injuries that are very common that happen to almost everyone, not specifically athletes. What are methods that we can do that can prevent these injuries?
Okay, just wait. Who know FIFA 11? FIFA 11. FIFA 11. Good. يا جماعة FIFA 11.
Guys, FIFA 11.
يا جماعة FIFA 11. اوكي. دكتور؟ ايوه انت. الاسم؟ Your name؟ اوه بالصدفة كذا ترى ما اعرف. اوكي. طبعا ابوه استاذنا في العسكري. محمد طيب بالصدفة ترى ما اعرف حتى شكلك. اوكي. محمد what is FIFA 11? Okay, thank you. No wonder. I made the research and study about the FIFA 11 على الهلال، النصر، الاتحاد، الشباب، الأهلي. All soccer player. Surprisingly, no one know. All of them, they said FIFA 11 is a game. Okay? But FIFA 11, it's a rehab protocol to prevent ACL injury. Okay? It's like 13 or 14 type of physical therapy, which the patient should do it prior to soccer player to prevent ACL injury. No one know about the FIFA 11. Okay? كان من السؤال الورم اب and cool down. It's very important to prevent the sport injury. It's come to my mind. Who know CrossFit?
Come on, I know a lot of girls do CrossFit in med school.
Okay.
Actually. Okay, good.
بما اني director of research committee في orthopedic department, it's come in my mind about the CrossFit. I face a lot of patients in my clinic, a lot of severe injury due to involving CrossFit. So I start telling my patient, please don't go to CrossFit. This is what I believe. And I would like to do a research about that. I believe that CrossFit is very dangerous sport activity which cause sport injury. So I did the research to prove this idea. The good things, my idea is wrong. Okay? But I have the answer. 45 patients who have sport injury due to CrossFit, they don't do cool down. Okay? So it doesn't mean that CrossFit itself is dangerous. That means that this athlete, he did not involve in warm up and cool down. And there is, do we have the question, I think, do we have a proper CrossFit trainer? This is I think the question should be raised instead of CrossFit is causing more sport injury.
Can I answer?
Yes.
Okay. CrossFit so far, the only actual gym that is certified globally in Saudi Arabia for CrossFit is CORE. The actually certified coaches for CrossFit are only 2 in Saudi, even though there are a lot of people that do teach CrossFit. As for males, I have no idea. I don't think it's as popular in a way, because for females, it's pretty popular. So either you do spinning classes and yoga and Pilates, or you do CrossFit. There's no in between. But you need to make sure and then you're going to the right, first of all, to the right gym that has the best equipment, and for you to actually do the proper warm-up and cool down with the actual correct coach, because, I mean, you don't want a rotator cuff or a shoulder dislocation or an ACL injury or an MCL injury or any of those. So you have to make sure you're doing okay and your health is top notch. But I think you guys were done. We talked about warm-up and cool-down and G-flat 11, which is, as the doctor mentioned, the technique. It's a couple of exercises. They're over here. We also mentioned it in our one-pager, so guys, please check out our one-pager. We already distributed papers on you with scan codes. Before that, we want to end this session, let's say, with a Q&A. So the floor is yours, our audience, and you guys can ask any question you want, and Dr. Bader is going to answer.
Sport or orthopedic? Yes.
Doctor, are you familiar with the acronym or mnemonic RICE? Rest, ice, compress, elevate?
Yes.
Is that accurate? Would you recommend us to do that in the case of an injury?
Always. We have to apply this RICE whenever the patient have, I'm not going to say twisting, any swelling after an injury. Okay, any swelling, we have to do elevation, ice compression. This is very important to decrease the swelling. Yes.
Okay, next question.
تفضل.
Yes, during prevention, there's a method called cryotherapy. I wondered if you've ever used it, like the past effect.
ما نسمع الأول إيه؟
Cryotherapy.
Yes. Always they use as sport medicine ويستخدمونه عادة في التيم اللي أتكلم عنه sport medicine physician اللي هم أو الريهاب اللي هو يكونون في السين نفسهم. أما إحنا as a surgeon لما يجينا في الكلينيك we don't use it عادة.
Okay, Dr. you need to choose someone for the next question, or should I?
تفضل.
Doctor, do you recommend, I've heard a lot about doing yoga in the morning or doing stretches in the morning.
I don't know. The orthopedic surgeon should not answer this question, so I don't know.
Okay, the question was, do you recommend yoga and stretching in the morning? The answer is?
I don't know. Really, I don't know. But I think it's an activity. Everyone should do an activity. But do we recommend or the other way? I'm against? Of course not. Yes. And تفضل.
Is there a difference between shoulder dislocation and dislocation in any other parts of the body, like in severity?
Okay.
Is there a difference between shoulder dislocation or any other parts of the body?
Yes.
Finger dislocation.
Finger dislocation, etc.
Is dislocation the same? But if you mean the severity, yes, there is difference. For example, posterior shoulder dislocation usually is difficult to diagnose, or let's say misdiagnosed. Okay, knee dislocation always necessitates surgical intervention. Finger dislocation, you can just reduce and then splint it. That's it. So in the severity, yes.
Okay. next
تفضلي.
question.
Do sports medicine physicians collaborate with physical therapists, or is part of your training physical therapy or learning the techniques of physical therapy?
Okay, so sports medicine physicians, do they work with physical therapists, or is it a part of the training?
Yeah, I think this is her question. Do you mean as a orthopedic sport medicine? Usually we don't go in deep for physical therapy, but we know exactly, we are the one who put the protocol for physiotherapy and how would I like the physiotherapy to go with my patient and my protocol. There is different protocol from surgeon to surgeon.
Okay, Ghadir, you can ask your question.
Do you recommend the sports medicine as a subspecialty?
Do you recommend sports medicine as a subspecialty?
And how competitive is it to get into sports medicine?
And how competitive is it to get into sports medicine?
طيب as an orthopedic surgery, as a sport medicine in the orthopedic department, not as a family medicine or emergency. Okay. So I think the right question is, can female go to orthopedic? Clearly. Okay? This is the question should be. I'm total. It's wrong to say that it's the orthopedic is just for male, or I think it's not fit for female. From my, I choose 2 female this because I'm program director. I choose 2 female out of 5 in this year, because I believe orthopedic, there's a different subspecialty: pediatric orthopedic, foot and ankle, sport. You can imagine you don't need to touch the patient in sport medicine just by scope. So there's no need to go through into spinal surgery. Would take sometimes 6 hours. Myself, I can go to spinal surgery and in fellowship, or trauma surgery. I will never go trauma. Never ever as a trauma surgeon. So as a female, you can go subspecialized in orthopedic and subspecialty pediatric, foot and ankle, sport, hand, a lot of upper extremity, a lot of subspecialty. So orthopedic oncology, arthroplasty. There is 2 female consultant arthroplasty. So I think you can go through orthopedic, then sport medicine if you want.
Doctor, I have a question.
Yes.
Is it actually, because there's a common thing said all the time in the orthopedic surgery in general, is very labor heavy. There's a lot of lifting and throwing and moving people's body parts around. Is that actually true?
Actually, I never touch my patient to prepare him for surgery. يعني as a consultant, the patient, I can go through this question answering the only one who's involved in lifting the patient, the trauma surgeon and spine surgeon. Otherwise, no. So believe me, if I feel that myself, I will not go to orthopedic.
Yes.
Is it actually proven that anti-cold pads have an actual impact on like injuries and how to heal them faster?
Did I hear you correctly? Is it true that hot and cold pads what?
Proven to like help in rehabilitation?
Proven to help in rehabilitation.
It's not help in rehabilitation. Help in treating this patient or management as a first aid. That's it. Yes?
Doctor, so you said to subspecialize in sports medicine, you need to enter through emergency medicine or orthopedic surgery.
I recommend orthopedic.
Yeah.
Okay? To be a surgeon. Otherwise, you will not. Okay.
Do you think in the future it could be a specialty on its own?
See, I don't think so. I hear about that in after finishing medical school in the United States. I'm not sure about that. They enter immediately through arthroplasty, okay, or sport medicine or spine surgery. So they will take 4 years. But I don't think it's gonna work.
There's someone with a question in the back wearing, was it in a hoodie? Yes, please, what's your question?
Excuse me, doctor, how effective is PRP in regards to sports-related injuries?
How-
I've heard about it, but I haven't seen it being used that much in sports.
Okay.
How effective is PRP?
Okay. Please don't use PRP. Okay. The study show the effective of PRP in specific injury like tendon Achilles, like tennis elbow, and sometimes rotator cuff. Otherwise, and patellar tendonitis. So there is specific disease treating PRP. But like in some hospitals say, okay, for osteoarthritis, PRP, no, there is no effective PRP. Okay. When I say that, I mean the study which is level 1 or 2 supporting an PRP.
Okay, any last questions? Because we're almost done. Yes, go ahead.
ليش last؟ تبين مخلصون؟
Hey, oh, we need to do an activity.
Okay.
Doctor, not only for like surgery, but sports medicine in general. I'm guessing you have like football stars or maybe professional boxer players or anything, like people who made this sport their career. I'm guessing they have injuries that end their career.
Okay.
So about that, do you refer them after like having a career-ending injury? Do you refer them to, psychiatrists or anything about mental health, or are you just concerned with the sports injury? I mean, as sports medicine in general, because mental health is an important part, and I'm guessing it's the mental health of the patient who had a career-ending injury would deteriorate.
Okay, this is an excellent question. Actually, the patient who require mental health referral, usually they present after the technical referral, especially because as I said, it's a team. It's sport medicine, rehab, psychologists, all the teams. So they come to us as an orthopedic sport medicine after he finished all these steps, and we are the end result for this injury. So I will bring the question another round. The patient who came to me with significant sport injury, usually because visiting other surgeon who is not specialized in sport medicine, and this is very important, very important. For example, everyone do knee scope, okay, for ACL injury. Anyone who, even if he's specialized arthroplasty, because this is a basic surgery who the surgeon trained during his residency. The problem is if the patient face meniscus tear, which require repair, he's gonna do debridement because he don't know how to do repair. If he have a root meniscus, which requires surgical intervention and repair, he will do nothing. He just debride. This cause significant impact on the patient and the result of ACL, and may cause re-tear for the ACL. Question? Yes. اسألوا ما عليكم منها ترى. Sorry, again? Yes. Yes.
That's one of the concerns, right? Like, as you said.
Yes, exactly.
Is treatment for optimal conditions the key when you do orthopedics?
Should be.
And it's not, I think your point to the question is, a lot of people try to, let's say there's some ACL tear, so they'll try to repair the tear, but they're not necessarily concerned with the person being able to still use the foot like it was before the injury. Is that what you mean?
Is that the difference between sports medicine and other subspecialties of orthopedics?
طيب ابغاك تعيدين السؤال عشان افهم كويس، ما قدرت افهم السؤال.
You're specialized in sports orthopedic surgery. You have a patient and he's proficient in sports. He's a football player.
Okay.
So you want him to return to the same condition as he was before he got the ACL tear. But if it was someone else that is less specialized, then
Okay, I understand.
you can do it like.
Okay. No, this is not our aim. My aim to bring a patient, okay, any patient, to his prior activity. Either he's an athlete or he's a normal person, he's not involved in sport activity. I have to bring him back to his prior status. That's it. Okay? Any more questions?
Question.
Yes?
Yes.
Yeah.
Oh, is that the question or?
Doctor, most of the injuries discussed in the PowerPoint were hyperextensive, like ACL tear or maybe rotator cuff. do you guys also deal with the blunt trauma which occurred to any sports, like, let's say, we have a game in our country, it's called cricket, and most of the injury from that is blunt.
Block?
Blunt injury from cricket.
Yeah, okay.
So basically the ball comes and hits you if you're unable to block
Yes.
it. So do you guys deal with those or just the hyperextensive type of
No, any type of injury. Any type of injury. And even I'm telling you, this is ACL. The hyperextension is the second most common cause of ACL, but usually it's twisting injury. The shoulder dislocation, usually due to abduction, external rotation. It's not just pulling out the shoulder. Yes.
Just in case I dislocated my shoulder, how do I pop it back?
Just call me. Okay. Yeah, you're gonna be in severe pain. You cannot do it by yourself, unless you have hyperlaxity. So it's gonna go back itself.
Okay, thank you guys for all the questions. We would need you guys to just do the interactive activity. As for your doctor, thank you so much for coming, and we are honored to have you.
Allah ya'tikum al-afiyah.